Hi, my name is Taylor Smith, and for this presentation, I will be talking about can virtual reality be used to treat schizophrenia? There are many different types of biotechnology in our world today, such as medications and prosthetics, etc. For this presentation, I would like to focus on what virtual reality is. Virtual reality is a type of biotech that is becoming more prevalent in our everyday lives and is intended to treat mental illnesses such as anxiety disorders and schizophrenia. Schizophrenia is one of these illnesses that VR is now helping to treat and will be the disorder that is focused on throughout this discussion on virtual reality. To start, I'd like to give some background information on what schizophrenia is and then lead into some of the current treatment options. I feel like if you are all more informed, then it will help you to understand the virtual reality aspect of treatment. So, what exactly is schizophrenia? Well, schizophrenia is a type of mental illness that can severely affect the way a person behaves, thinks, and feels. It only affects 1% of the world's population, but someone with this disorder can experience visual and auditory hallucinations, disordered thinking, difficulty with their memory, become out of touch with reality, and other disorganized behaviors. Some of the current treatment options are electroconvulsive therapy, which is also known as ECT. This is when someone is electrically induced with seizures, and these patients are usually someone that suffers from a severe mental disorder like schizophrenia. ECT can also be paired with antipsychotic medications, which are primarily used to help someone manage their symptoms of psychosis, which is a part of schizophrenia. One example of an antipsychotic medication is allopurinol. A more self-explanatory type of treatment is one-on-one therapy or therapy groups. This is where someone would go in to talk to a therapist or people that also suffer with a similar disorder, and they would go in and talk about the situations that they've been dealing with, the symptoms they've been having, and their therapist or their therapy groups help give ideas and tips on how to develop better coping strategies. So, what exactly is virtual reality and how was it developed? Well, virtual reality is a computer-generated simulation of 3D images and environments that someone can interact with in what seems like a real or physical way through the power of technology. Some may not know this, but virtual reality has been around much longer than most people believe. In 1957, Morton Heilig created what is considered the first VR system, and it was called Sensorama. His idea was to have an interactive theater. So he wanted someone to be able to go into a box-like area and be able to not only hear the sounds and see what's going on, but smell it, feel it, all of that. So it was a mechanical device which includes a stereoscopic color display, fans, odor emitters, stereo sound system, and a motional chair which simulated a motorcycle ride through the city when combined all together. Since Sensorama was created, VR has been improved upon into the creation that we use today, so the headsets and the games that we have. How does it work in the treatment of schizophrenia? Well, Daniel Freeman, who happens to be a clinical psychologist at the University of Oxford, and his fellow colleagues created a virtual simulation called GameChange that patients who are attending therapy can use alongside their one-on-one discussions. So they would put on the headset and they would be immersed into a simulation. So this simulation is more advanced than an in-person therapy, and the patient will be able to choose from 6 different social situations with their virtual therapist. As they go through the simulation, the therapist will help guide them while the patient will be able to freely behave any way they want. In other words, they will most likely act in a way that is more risky for them because they know there are no consequences in the simulation, whereas in real life there would be consequences for the way they act. When they do this, they will learn that they do not need to be fearful in real life, which helps to eliminate paranoia or other psychosis symptoms. So this image in the bottom right-hand corner that you see is actually the virtual therapist, and this is a scene right from GameChange. And this is the cafe simulation, and the person that is using the headset would be asked different questions by their virtual therapist, and they would have to go and maybe buy something, go take a seat. They can do whatever they want, and all the avatars within this simulation are acting just like regular people would in a real cafeteria. So, what are the different ways VR can specifically help schizophrenia? There's actually many different ways. And first up, we have symptom assessment. So, during the simulation, the VR system poses different questions and situations, such as the one you've seen in the first image there. The patient and the real therapist that is in the room with them will be talking to one another as the simulation occurs. The real therapist may pose questions or ask for their feedback as the simulation occurs. And whatever situation that they're in, the patient may have different persecutory thoughts, or they may describe something they heard that is actually an auditory hallucination and is not part of the simulation. And the real therapist can record these things and figure out how often their symptoms occur. Next, we have establishing symptom correlates. So, the settings provide a great place for behavioral and physiological correlates of symptoms to be studied. The therapist and the system can track different things such as the eye movement of the person, their blood pressure, their heart rate, etc. And all of these things can be compared after the treatment to figure out when these physiological and behavioral symptoms occurred so that they compare it with when their psychosis symptoms occurred and in what type of setting. The next few things that we have are more self-explanatory. So third, we have identification of predictive variables. The simulations can help allude to what variables in real-life situations can lead to a misinterpretation of a situation. So for example, a person in the cafeteria may look over at the patient and they can become paranoid and actually take that look that they gave them the wrong way and misinterpret the situation and start to hallucinate. Fourth, we have identification of differential predictors. This is similar to the last benefit, but different because it focuses on how VR is a method to highlight on factors that can elicit specific symptoms of psychosis within a person. Next, we have identifying environmental predictors. The simulations can be altered to determine what environments cause psychosis symptoms to occur more often. And lastly, we have developing treatment. So the VR systems can actually teach patients about the factors that make their symptoms better or worse so they can identify them in real life in order to apply their new skills. This is actually very beneficial because there isn't many options out there for schizophrenia that can be tailored to each individual. Second, there is exposure to anxiety slash paranoia inducing situations, which, as mentioned earlier, can lead them to develop new coping strategies. And lastly, they can learn to cope with symptoms as they occur. What are some other benefits of VR treatment? Well, VR can alleviate symptoms of schizophrenia, as mentioned earlier. It can improve a person's coping skills slash strategies and can lead to a person with schizophrenia to actually re-engage in daily activities that they may have withdrawn from due to their disorder. So what are some of the ethical implications of the use of VR? The simulations can be tailored to mimic common hallucinations. And that's honestly the biggest ethical concern because many people think that can be wrong and that it can actually make the symptoms within the person worse. But in reality, actually, the virtual reality systems are improving the person's disorder and helping them a lot more than any other concern that people may have. Second, the virtual reality systems may also come with a soundtrack that gives an abusive running commentary, and that kind of goes with the last one, because people can have auditory hallucinations, and this is actually something that people with schizophrenia suffer from is abusive running commentary. They think that it's actually not a good thing, like similarly to the last point I made, because they think that it just continues to worsen their symptoms when in reality it doesn't. And lastly, a patient that is being treated with virtual reality may find some of the simulations frightening, which can cause many people to find this unethical, just like the last ideas mentioned. So in conclusion, virtual reality is a new option for treating someone with schizophrenia while it is paired with common talk therapies. There are some ethical concerns, but there hasn't been evidence to prove there is anything wrong with this process. This biotechnology provides lots of benefits such as symptom assessment and establishing symptom correlates, identifying predictable variables, environmental and differential predictors, establishing causal factors, and provides new coping strategies. So I've also included my works cited page with some of my commentary for each one in case anybody wanted to look into this a little bit more. They could identify the article they want specifically. And this is obviously my works cited for my image.